I'm staying out of the way and reading.
They are so cute.
They do come in 2 sizes.
Huh?
It's a 5-person operation.
So, what do you guys think of the belting?
I think the belting is wonderful.
This 99 I know about it yet.
I don't know what building are you talking
Jay,
about.
She doesn't know about
Jay,
it.
just turn the pitch camera around. Remember, you can do that?
I'm using video right now.
Oh, okay. Well, still.
It's part of the...
The cloth
Smile
that
for
we'll
Donnie.
get to throw bells on.
How about like this?
Possibly a long ribbon. Or something
not
like a
ribbon.
shawl with bells all around
I
it.
always thought of it as a shawl in the story. I have no idea what it really was, because I don't remember Jay ever
Yeah, was it
describing
like a... No, it's a long piece of cloth.
Look at the
Come on.
cover of Kalumpur. He actually draws it on the cover of Kalumpur.
Oh.
I mean, of
It goes on forever.
Yeah, you
Not
wanna make
California, the
sure
cover
we
of
get
it.
You know the
Yeah.
story that's
Under
hiding
this.
behind you.
Endurance.
It's done in blood.
What?
That's pig's blood. Pig's
Oh,
blood.
wait, I thought it was human blood. I was like,
No, it's pig's blood. That's probably enough because we'll have to work on that. It's
Yeah.
mainly to make sure we don't get him there.
Okay.
Do y'all want to hear the first few items from the list?
We want one at a time, I think.
But-
Yes, please.
When pump alarm infusion is complete,
Been
take
there,
out
done
the
that.
battery to stop the pump. Okay.
Got it.
Wash your hands.
Yes.
Put on chemo gloves.
Yeah.
Yep.
That- that-
Clamp the tubing on the port needle, or if you have, do you have a
yeah.
pick line?
No, we haven't.
This has been clamped.
Okay.
You may also want to clamp this side.
Yeah.
Bring it up to here and clamp it.
But if you have a pick line, close the clamp closest to the insertion site.
Don't worry about the pick line. It's not...
No, pick line not relevant?
No.
Okay. Disconnect the tubing from the blue connector.
Right there. And you twist it.
Have I
don't
caught
you?
up with
Yeah. And I have to make sure that I do not touch it.
Okay.
The
And
end.
then
There we
that-
go.
Red
And-
cap.
That has to have the red
Place
cap.
the red cap at the end of the IV tubing.
Okay, just a minute.
Oh.
Wow. This red cap doesn't have any...
We have scissors.
Where
There
are
are
the scissors?
scissors right behind us. Right behind me?
Pick that up later. There we go. Red cap. He's going to carry your luggage for
Not
you.
there.
Not there?
On that one.
On this one.
Right. We will need another red
IV
cap
tubing.
later.
Okay, do you want to do the red cap on that? Because I've got to hold this one so that nothing touches it.
And it
Now.
goes... It screws on, Jay, like
Yep.
this? No, this way.
That way. There you go.
It's double-ended. It depends on which end of the thing it's...
Yeah. So we need another red cap out of
You
that
will
thing.
need another red cap.
Okay, so we need to get that out.
Place
So-
the chemo bag, tubing, and pump in a Ziploc plastic bag.
Do we
And
have
place
one?
that bag in 2 plastic
It's-
bags, securing the
it-
outer one tightly.
It's in there, so it's okay.
There are Ziploc plastic bags in the kitchen to the right of the
Or in
sink.
kitchen.
In the drawer to the right of the
Okay.
sink.
Gung, Gung, do you want to see this?
Okay, and so don't move don't move your leg, Jay.
I am still.
So
Okay.
that's the
Okay,
chemo
we need
bag,
saline?
tubing, and pump.
Yep.
No, we have to. Is this the next one? It's this one, isn't it?
We'll wipe it when
Oh,
you've
the
got the
saline.
saline ready. Yeah,
Okay.
because otherwise
Are you
Otherwise
ready?
it's
Are you
too
ready
Is
for the
saline
next?
next?
The next says wipe the blue cap with an alcohol wipe,
okay, I will hold,
Okay.
I can hold that while you get the alcohol wipe.
and then flush the port with
I
10
didn't know how
milliliters
big.
of sterile saline.
So
Big is good.
Big
is
one.
good. Okay, I got 2 big ones and 2 small ones too.
It can go in the. All that has to go in it.
But you shouldn't put it
Okay,
in
you
the
can
glove.
wipe
Let
it.
them do it.
You've got it right there.
That's fine.
Okay.
Okay.
The gloves, that's right.
Want me to hold this?
No, I've got it. Thank you though.
Are you guys at flush the port?
We're flushing one.
So
Yes,
I'm going
it's-
to take the one cap off the saline.
Yeah, the white cap.
Yeah, and
Next
if you hold
time
it
I
down
give you
so
one
that
of-
it'll, like,
I'll give you the white
it'll focus for you.
without the white cap.
It's 2 salines and a heparin.
Yeah.
Yeah.
Okay, now I've got it undone.
Remember, you got that special instruction from the
Yep.
nurse.
Yeah.
And what was the special instruction?
Pumping it.
Oh, yeah.
Ready?
Okay. We
Bubble
put
up.
the white back on it, don't we, before we throw it away?
Yes.
You good?
I smell the ocean.
This is
Can
flush
you?
the port with 10 milliliters of saline.
Yep.
Yeah, but that takes 2, so we'll
Okay.
do the next
So
one.
you're doing 5 at a time?
Yep.
That's what they give you.
Leave a little in the end so the bubble doesn't come
That's
down.
fine.
Yeah.
And then 5 milliliters
Yeah.
of heparin.
And the heparin's the yellow one.
Done.
Okay.
Thank you.
This bag needs to go into another bag.
Does two bags?
Bag in, bag.
Okay.
Can I smell the ocean again?
Yeah. So I should probably get some more then? Just one. It's. I think you double bag it.
Okay.
Isn't that what it's? I think that's how we
That's
always
what
done.
Sita said, yeah.
It's actually 3. Place it all into a
And the
plastic
heparin
bag
gets
and
pumped
place
as
that
well?
bag in 2 plastic bags.
You want me to take that
And one
off
more?
for you?
Put in
One
one
more.
Got it.
Okay.
Just got it. Yeah.
Okay,
thank
now
you.
5 milliliters of heparin.
That one was really tight.
The hard part is occasionally the blue ones don't
One
come
more
apart.
bag. One more big
A couple
bag.
times we had to get pliers.
Oh, you're kidding.
Nope.
I have to get that.
Oh,
There's
yeah.
the clamp.
I was just thinking how much easier this
Sorry,
was.
I just need to grab that
My
clamp.
Okay, I
memory
went
of the
ahead and
time.
just got 2 more.
We'll put
Okay,
that bag.
heparin. Here we go.
This again.
Okay.
Okay, I thought we can like let more air out.
And I see you're pumping it in little surges.
Yes,
Yeah.
we got a very detailed
So it goes
lecture
in
from a nurse the
slowly
other day.
in. Is that going
Okay,
in
the
properly?
heparin is done.
Remove the dressing from the
Wait,
pot.
wait, wait. You're ahead of yourself. You need to clean that one and red cap it.
Okay.
Yeah. And we didn't get out enough things. Joe, would you get that bag down right there?
Brown bag?
Brown bag. Get us a red cap and a little white. Is that where you found the whites, or were they in the other one?
There
They
were
were in
white.
the
There
others.
were wipes
They're in the
in
orange.
the picnic basket.
Try the picnic basket.
Try the orange basket then.
There you go, CJ.
Now
Good.
Yes.
Now put that in a regular grocery bag. You know where I keep those in the right handmost drawer?
How many
Okay,
red
and
caps
we
do you
need another. All right. then
Thank
we
you
need
for
a
helping, Bronwyn.
saline thing. A little.
You're doing
Not a
stuff
saline,
that's not
an
on
alcohol
here at
wipe.
all right now.
What is a saline?
Alcohol wipe.
little
She
alcohol
she
wipe.
misspoke.
I'm
It's
sorry,
a
not
1-inch
saline.
square alcohol wipe. It should be in one of those bags in which you have right there,
No, it should be in that.
or in that one.
Bronwyn, go in the kitchen and get
I
a
think
grocery
it's in
bag
the
like an
orange.
Albertsons bag. It's in the orange one, Dad.
Okay.
Look again.
Here, we'll put it down and look at. Jay said he had a lot.
We counted them the other day, like 11 of them.
They
You
didn't
had
end
them
up in the
beforehand?
brown bag, did they?
None. I just need an empty one.
Oh, just a regular plastic.
Yeah.
No, they're little, like you gave.
Just
I know.
Yeah.
I think I know what we're talking about, but I do not
the
see
little
them.
flat thing.
Oh, here's.
Yeah. They're so tiny.
Wait, is that? No, that's not it. That's that.
Did you just get like a whole bunch of extra
That's
Albertsons
the-
bags?
It's alcohol.
Dad, did you
Alcohol.
Yep,
wipe.
that's right. That's right. Yes, Bronwyn.
Yeah.
And kind of just twist that.
No?
Yep. Yes, perfect, Bronwyn.
Okay. I'm not sure.
And then put it up on top of the closet there where we got the stuff down from.
That's not out yet, so it should be okay.
And then Dad can arrange it, or you can help Dad arrange it.
What is? That's the one to get me taken back.
Yes, that's the one we take back next week.
But we don't.
wiping the end.
Yep, wipe the end, put a red cap on.
And I think this one
And
Goes
then
is that way.
remove the dressing from the port, but be careful not to pull the needle out.
And we need the detach-all for this.
Yep. Got
Now,
it?
the question is, because you've got it on the derma stuff, will it come off the
Well,
derma?
I have no idea.
Okay,
We've never done this
let's
before.
do the detach-all
Okay.
on it anyway.
It says to crush it before you open it.
Yes,
I
you
thought-
snap it before you open it. There you go.
Yeah. All you have to do is hear that. Oh, these scissors. Very useful. Much easier.
Is that showing the wound?
Yes, it is. It's
okay.
beautiful. And if you put it right there, good. Now you've got, yes, it looks beautiful.
And you see that funny little end?
Mm-hmm.
And you just sort of
Rub it with that end.
rub around the. Is there a place that we can sort of start up? But you want to make sure we don't take that
Yeah.
off.
She said it differently this time at the request. So we'll
And
see.
then if you start it up, because you want that to go on the adhesive, like under.
yeah.
Yeah.
Got it.
So just start going around there. On the skin.
Against the skin.
Yeah. And then it'll slowly give way. And we've got lots of these. I've got 4 out. I think we might only need 2.
Actually, this is coming off very nicely.
What we really were hoping for was less rash.
Yeah.
Yes.
Because the rash I got from the post-op dressing from the porting plant was horrid.
Well, instead of Band-Aids, too, we're going to put on gauze and...
Yeah, she gave us
hot
special
tape.
tape.
You can buy that at Walgreens, too.
Yep.
But what we do need to buy for next time, because we're just going to cut one now, are small gauzes. Didn't have any, just big ones. Oh, look at how nicely, that is
Yeah.
really coming off very nicely.
That's the skin
Yeah.
look.
Skin looks actually, it's still red,
Yeah.
but it's not blistery like it was before.
That Duoderm is helping.
Yeah, I think
Hey, you
so.
guys, I'll be back.
Okay.
Yeah, it's coming off faster, too, Jay. No, we got to be careful right here.
Yeah. Just kidding.
And then you
Usually
can
we come
go
around the top and do that
top
part
and then-
last.
Yeah,
Yeah.
that I remember. And of course, it looks very different from your perspective, Jay.
Right, I'm not very much help here, even though I keep talking.
You talk so well. Actually, it's good that you keep talking.
I am well known for my reticent laconic reticence. Laconic reticence.
Can you say that 3 times?
Laconic reticence, laconic reticence, laconic reticence.
You know, I got to say to Dad the other night, language is a tool for communication.
Did he believe you?
Well, he said, we were sitting in Mike's with Delaney. He said, can I see your phone? So I opened my purse and said, see, there it is. And I closed the purse. And Delaney just went into hysterics. He asked to see it, so I showed it to him.
Literalism.
Well, he always said, communication is,
Right in there in
language
that
is a
corner.
tool for communication. If people aren't understanding you, you aren't using it right. How many times have you heard that? When I told Q the story, she immediately said, language is...
Does that hurt?
Words mean exactly.
I mean, I'm getting sensation, but I wouldn't call it pain.
Okay.
Well, that stuff must be a little cold or feel funny, doesn't it?
Not really. Do you need another bottle and attach all of that?
I'm
need
going to
another
need in a minute, yeah.
Okay.
But it's just where the Duoderm is stuck at the top here. It's very tight against your skin. Oh, there, it finally came off. It did not want to come off at first.
Are these the way they used to always open? They seem much harder to get out this time.
Yep, you always have to crunch them.
Yeah, I know, but I
It's old
mean,
age.
it was there used to be
Thank you, Dad.
you could get it out a little easier. You could peel it back, but it doesn't seem to want to peel back.
Are you,
You
ready
should
for
move the camera
once
down a
dressing
little bit.
is completely off
Yeah,
instruction?
yeah, there you
No,
go.
not yet. Okay, I can't
Nope,
even
we're
get this
still
one out.
on the dressing.
We're still taking dressing.
This is the longest part of it, I think, isn't it? Usually, Jay?
Yep,
Because you want to...
we want to be careful. We don't just yank on
Jay
this.
doesn't like you to just yank. Well, you
Oh.
can't, because then you ready for another one?
Just about here. Talk about instant waxing.
always told me
Mrs.
to
Brown's
get quickly.
bikini wax.
Well, you don't want to take the needle out. That's the
That
problem.
Canadian boot. A boot.
A boot?
A boot.
Here's another one if
Yeah.
you're ready.
Okay.
And I'll take that one.
Yeah, why don't we just trade? Because I think
Yeah, I
it's
think
right
it's-
at the...
I think you've done so much with it, yeah.
Can you move the camera for Jay so he can get the... I don't think he's got it quite where he wants
What
it.
do you want?
He just to show, just to move his hands so because he wants to see what's going on here.
There you go, Jay.
Thank you, Mom.
You're welcome. I can handle that. That's easy. I got out a couple more of those in case you need it, but I don't think you're
Yeah,
gonna
no,
need
I
them.
don't. I don't think I will.
But I think we know now. Get out multiples just in case.
Yeah.
Easier to put away.
Yep,
Than,
always get out multiples, always.
Yep.
That makes sense.
We need to rearrange the carriers because we brought the stuff home in the paper bag but didn't integrate it with the existing stuff.
And it's too soon to do it because we've got to get rid of those old heparins and stuff.
Yep, the old stuff has to be thrown
Yeah.
out.
Are you watching this, Jay? Is that what you're doing?
Well, I will be. I can't see it from here.
Oh. Oh, you're taking.
That's
a
why
video.
he wants the video.
Plus, Donnie wants it.
And the other camera's on.
I believe so.
Yeah.
I can't tell from here.
Is that camera on, Joe?
I have no idea. It is. Oh yeah, it's got It's got the red light on. That must be it recording.
And then we don't take this all the way off, or do we?
Well, the next instruction starts with once the dressing is completely off.
Oh, okay.
It has occasionally been my experience in the past the dressing lines have wrapped around the line, But as long as we clear it away from...
Yeah.
I
What-
think it's
what-
okay.
What
And
we
you to remove it from the port, the
So you,
dressing.
yeah, but see, you
Be
want
careful
no.
not to pull the needle out.
what we need to do, actually, I need a little slack there because I'm just trying to get underneath here just a little
Okay,
bit.
because you don't want to pull that off.
No, I understand. I've got it gentle. But what I should have done, and what I'm going to have to do, is to remove the top bandage before, because this is secured by this one on top, I realize now, and so I think I might have to do that. Can you get me the scissors? We've got to get these hair. Get those couple of hairs cut off there, Jody. See right there?
Ah,
Right here? Can you see there and there? Or do
no.
you want me to do it? Okay.
I'll let you do it. I don't see them at this
I
angle.
only have one nipple, remember?
Oh, I know, baby.
You don't want an
She's
extra?
inches from it.
There,
Don't worry.
there. That'll be less painful.
So you need to shave your chest before next time?
Oh, that'll take care of itself pretty soon.
Hair?
It's like a full-body Brazilian.
I loved it, Robin saying, Jay, I've never seen you with so much hair.
Okay, can
Have you
hold
seen
that for
Mrs.
one
Have you
more?
seen any of the Mrs. Brown's clips on YouTube? There's a horrible, horrible clip of her getting a bikini wax.
Mrs. Brown?
Not Queen Victoria.
No.
Not that Mrs. Brown.
Now when I think of Queen Victoria, I think of her as she is in Mainspring and
Escapement.
an escapement.
Yes, when she's the
Yeah,
zombie floating in the tub of nutrients. Yes, what I did to her was not kind.
This is a very slow process, isn't it?
This is the slowest part of it.
How do you think I feel about it?
Oh, man. If I was you, I'd probably needed a bottle of wine.
Just what Bush, Cheney, and Rumsfeld did. You know I didn't name my tumors Bush, Cheney, and Rumsfeld.
I knew you did Bush and Cheney. I hadn't heard of Rumsfeld.
He's a little bastard at the back trying to sneak into the peritoneum.
Should have been Ashcroft.
Well, that's true. That would have been a good
Could have
one.
been.
Now,
I wanted to name them Vera, Chuck, and Dave.
Vera, Chuck, and Dave.
Vera, Chuck, and Dave.
who are Vera, Chuck, and Dave?
From the Beatles song, When I'm 64.
Oh,
Oh,
Grandchildren at our knee.
Vera, Chuck, and Dave. Da 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 bum.
why didn't you?
Because I put it to a poll for my public.
Oh,
Well, there was an article in today's New York Times alleging that one of the secrets that Romney has kept hidden is that he is a great admirer of Dick Cheney.
That's not a very well hidden secret, if that's a secret.
he thinks it's
He thinks it's...
How's my image on my camera?
her hand.
did I get you to hold that?
You want another one, or
I'm not sure here.
Okay,
Yeah,
so now
I'll
we
take
are
that one
at
back.
Remove the dressing from the port, but be careful not to pull the needle out.
Yes. And
Short instruction for a long process.
and there's don't we also we have to get that tape that's holding the needle in?
But you could just cut away.
I
some
am.
of this
That's
dressing.
actually that is what I'm thinking because this is all double.
Cut away the stuff that's up. And
Yeah.
just chuck it in the sharps box. Use the scissors.
Yeah, because that's not going to peel apart. Scissors, please.
If nothing else, it would make your life
Scalpel.
simpler.
Well, it may or it may not. Oh, sorry, got your beard.
You're a pal.
I know.
People with scissors
Whoops.
close to your face.
I know.
This is trust.
Yes.
Letting all three of your parents and one of your girlfriends get close to your face with scissors.
Well, I'll tell you.
Well, it's too bad we don't have John here.
Jody, there's
He,
another
he,
piece.
he likes to get close to the face with scissors too.
Hey, and let John work on her.
I
Yeah.
let John work on me. I walked out of there with blue hair.
Are you
Well,
serious?
you asked for blue hair.
Bright blue, like this.
That is on top of. Okay, let's try that.
Not the old blue hair. Remember the blue-haired ladies when we were in elementary school?
Yep.
Sometimes they got too much. It was sort of purple.
Yep. Kind
Lavender.
of violet hair. Yeah.
Was that like a rinse? What was the point of
Yeah,
that?
it was to bring out the white or something.
And then
Keep
made
it from
everybody
looking
blue.
Yellow.
Yeah. And it didn't look yellow, I'll tell you that. It looked...
And it became the color of hair you saw in old ladies. And
That's right. Do you remember, maybe you weren't at home when we were watching Are You Being Served?
Oh, I love Are You Being
Oh, yeah.
Served?
And Mrs. Oh gosh, I can't remember her name.
The lady who
the
was
older
there.
lady who
Yes.
always had different color hair.
I loved her.
Dad, did your mother call them BD operators?
My grandmother did.
That's an old. I know that's an old Southernism
Yeah.
for.
Yeah, she did.
Yeah.
Yeah.
Oh, shit.
Just what I wanted to hear.
No, it was sticky. I have to take my gloves off very carefully.
The worst part is if Jay says that, then
I
we all have
know,
to
and that's
worry.
what I'm trying to avoid
No,
here
I
because
was thinking more literally.
Yes. Well, I actually pooped this morning. I never poop on chemo,
They said you're reacting
This
very
is
differently
different.
to this
This
one
is
than the
different.
others.
which is
Chemo.
odd because it's the first chemo I had the first time, except for the Vectibix.
Well, something
I
is
will
different.
tell you, the first time you were, even the very first day, you were not nearly as alert as you were this time.
Well, yeah, you had to support him on the way to the
And I
car.
will go further and say that the other interesting thing is that you appeared to be in a lot more pain when you came home and the next day or
Or
so
discomfort.
than you are now.
okay.
I have no idea how much pain you're in, whether you tolerate it better or what, but it appeared to be more
I'm
significant.
not sure I would describe it as pain.
Discomfort. Visible
Well,
discomfort.
I think maybe they.
Do you have that? Can you run that on the scissors? Yeah, right there on the blade,
Just
on the
to
bottom blade.
clean up the blade.
Yeah, to the tip. Thank you.
The maybe you're just they're giving you now know to ask for things more,
Yes, I have a
When
much
you
better
have a
idea of what
problem.
to ask for.
and now you know to take that may be it. That helps.
Good.
I don't think you're seeing it, Jill.
Another bead, please. Thank you, nurse.
Jay, that was never anything that I thought I wanted to be. Back when they thought everyone should be a nurse or a teacher.
Well, you know
I
what?
guess we could have been a secretary.
I had the same thing said to me that I could have been a teacher or a nurse, and because people said to me you should be a teacher or a nurse, I said I don't want to be a teacher or a nurse.
Oh,
And I could have been very good at either one of them,
my
especially teaching.
my guidance counselor wanted me to go to a New York State Teachers College, and I said no, I don't want to be a teacher. I want to get I'm going liberal
May I
arts, and
have
I
a-
did it.
You became a teacher.
And then I became a teacher, and I loved it. But, I didn't take all those education courses. I took history courses and taught history. Although I did go to the University of Pennsylvania this summer after I graduated and took a couple of education courses. That was sort of a waste.
I taught English as a second language.
Oh, I've done
you
that
are
too.
English as a second language.
Yeah,
Yeah,
which is what made teaching it so fun. So much fun.
I did it overseas.
Okay.
I actually got certified by the
May
State
I?
Department in it.
Thank you.
Someplace I have a certificate. Well, maybe I don't have it anymore.
No.
Move your hand a little bit towards Sarah, Jay. And down a little. There you go.
Actually, I will come around this way to cut that off so it doesn't get in our way.
Well, it seems to me this part of the process is taking longer than I did.
We also have a different kind of bandage this time because we were putting on. She put that Duoderm on underneath the regular bandage, which makes getting it off more complicated, I think.
Yeah,
But
it
why did
does.
she do that?
To try to spare me the skin rash.
Okay.
See, he's not as blistery as he used to be.
It's not red and ridged. There's a little bit, but it's not what it was.
Okay.
But it's better.
Now, I suppose yes, I have to get all of this off now before we get.
Is it not going to come up as one?
I don't think you want me ripping that off your skin when I pull the needle out.
When you put it that way.
Right?
No, I'm with you. I'm good.
Down a little.
Okay.
To get,
So now-
Or maybe even up a little, I don't know. Angle. There. Oh, you got her hands there. Yeah, that's good. You're getting it right there.
Yeah, because I'm sure it would work that way, but I don't really.
When is it we have to put the fingers there to make sure it doesn't come out?
After the dressing is off.
Okay. You want another one of these?
I think we're going to need it.
Okay.
Please.
I'll get rid of this one.
When only the needle and the needle's pad are remaining.
Yeah.
seen the needle and the damage done.
Oh, you have the scissors.
Oh, sorry.
Finally realized what I'm looking at
There
here
you
is
go.
is the leftover from the surgery. Kept wondering why I had a blood spot from this.
I'm trying to get
I see
this
we
out.
finally lost Bronwyn.
She's out there chatting with her mother.
The fact that she hung out at all
That
surprised me.
is my surprise.
Okay, I need those again, I
The
think.
fact
There
that
you go.
she was over here so much during the day is what surprised me. Not just
Well, she was-
needling.
She was here yesterday at
Yeah,
10 in the morning.
The
Yeah.
video is what my
That she
attention.
was
Oh,
up
that
at 10
video.
in the morning was incredible.
Yeah, you saw our party video, did you?
Yep.
Can you pull that glove tighter down, Jody? Just pull it
Yeah.
tight.
They're a little big for
Yeah.
our hands.
Are there not? There should be a couple of blood glove sizes up there.
This
There's
is the smallest.
This is one size fits most.
And
There's another
yeah.
glove box up there. What size is it?
large.
Large.
Which is the same as one size fits none.
Well, they're a little better than the large.
What do nuns have to do with this?
It's just we have this little extra. I have extra at the end of the fingers.
There we go.
Says they are medical exam gloves. You guys gonna give ladies gonna give Jay a prostate exam when you're finished?
Not me.
That would be telling secrets.
If it's all the same to y'all,
Well, it will take your mind off any other pain.
that's certainly true. Is that the hit yourself on the head with a hammer so it feels good when you stop theory of?
Yeah, well, I
No
guess so.
pain control, yes.
Yeah, my mother used to say, "Bite your tongue, then you won't feel your sore foot."
Your mother was a helpful woman, I could tell.
Oh yes, full of sympathy, always. Your foot can't be too sore to milk cows.
You don't know cows with their feet, after all.
If a cow
Exactly.
steps on your foot.
Oh, actually, cow stepping
Oh,
on your
the
foot
lady
doesn't
that
hurt.
Got an elbow in the eye after you left.
Got an elbow in the eye.
A cow stepping
I
on your
bet she
foot doesn't
howled.
hurt.
No, because unless they just step on your toe, but if they step on your foot flat, there's no
I was
pain
gonna
because
say,
the
my memory,
pressure's
I had
even.
a cow step on my feet. It wasn't all that bad.
No, because the pressure's even.
Yeah.
That's my image on my phone.
All right.
Did your family
Pardon?
have a?
That's my camera
have a-
image.
You had a
Yes.
dairy farm.
A mixed farm, yes.
Okay, you ready
Sorry,
for the
what
next?
did you say, honey?
How's the camera image?
The camera image is lovely. And
Now
we'll
it's
just
great. Yeah.
There we go. See, now you can have a nice close-up just like that.
Okay.
All right.
Now-
Once the dressing is completely off,
Yes.
that's where we are, right?
Yeah.
Hold down the clear needle pad with 2 fingers of one hand and pull the yellow tabs together and upward with the other hand until it clicks.
Okay. This is the part that I was not looking forward to.
How do you think I feel about it?
Okay, we've got it. Now I have to put my fingers
And then
around the port.
Then you pull it up.
Do you want to move your camera away a little bit so I've got enough room for my... Okay, I've got to make sure I've got it both sides of the port. Man, that's tight.
And
Bandage?
then
Bandage?
Discard in sharp-proof container.
The gauze, please?
The needle, not the patient.
Thank you.
You want just half?
Apply a
This
bandage
is
to the
beginning.
port site.
Yeah, give me the... Here,
Oh,
give me a corner, please.
a quarter?
A corner.
A corner.
Corner.
Like a 1x1.
Yeah.
Practicing sterile technique in the home bedroom is quite a trick.
It can be done.
Yeah. It's enough rubber gloves.
Wow.
Rubber
You
gloves.
try-
You can take your rubber gloves off.
I was
at
going to
that
say,
point.
you can't possibly get the end of this off with...
I
Ow.
occasionally have procedures where the tech will cut the tip off of one of the fingers of the glove, specifically for things like that.
Okay. Want me to just tear it off?
Sure,
Is that enough?
I think so.
And this is non-irritating tape.
Allegedly.
Theoretically speaking,
Do you want just one, or are you going to...
I think one is good.
Don't,
Okay.
Yeah, don't tape over the stair strip. We good?
I think so. Just a moment here. I'm just going to grab the scissors because there's one corner on the steri strip, and that's just where the steri strip is coming up anyway.
Meet you.
There, that should be okay.
All right.
Then we
Good?
put our
And then-
gloves and
then it
everything in there,
says-
don't we?
It gives us a note that wash hangs well with soap and lots of water. So if you're going to hang out to wash,
Yes, that is a lovely typo. I noticed that earlier.
But let's suppose it means wash hands well with soap and water. Now, does this go back with the
I just want to make sure your
supplies?
paper tape does
I don't know
not
where he's
touch
gonna
that
keep
steri
it.
strip.
This is a new one, so it should go in here.
Lower, Dad. No, you're cutting only half your face. There you go. Or you can turn it sideways.
There you go.
Are you trying to get your face? Or
Yep, my face.
Because that's all you're getting. You're not getting the...
I'm just smiling at the camera.
Smiling for the camera.
gloves
So
and
we
stuff.
don't
Okay,
need
so
these?
this is